Donald Trump on healthcare. How the American Healthcare Act Affects You. By Kimberly Amadio. Updated March 09, 2017. On March 6, President Donald Trump and congressional Republicans released the American Healthcare Act to replace Obamacare. They don't have the votes to repeal the Affordable Care Act. Instead, they are using a budget reconciliation to change spending and tax aspects of the ACA. The Healthcare Act has 11 components. Trump promised to keep the two most popular Obamacare benefits. First, 3 million young adults up to age 26 can stay on their parents' plan. Second, those with pre-existing conditions can still get insurance. Companies may not withhold insurance from people who are sick. The federal government would pay $100 billion over 10 years to a patient and state stability fund. States could use the fund to increase tax credits. Some states might send the money to insurance companies who have a lot of very sick patients. States could also use the fund to create high-risk pools for those with pre-existing conditions. That would raise the costs for those in the high-risk pools. People with chronic illnesses would face higher premiums and larger deductibles. So would those with pre-existing conditions if they had more than a 63-day gap in coverage. Many companies already offer high-risk pools, called Cadillac plans, to their employees. Insurance companies like this option. Source: Sarah Cliff, The American Healthcare Act, the Republicans' bill to replace Obamacare, explained. Vox, March 6, 2017. Tax changes. 3. Remove the individual tax on those don't buy insurance. This amendment is retroactive to December 31, 2015. If the plan is approved, it would mean people who didn't have insurance in 2016 wouldn't have to pay the penalty when they file in April. That changes if people let their coverage lapse. If someone has been without coverage for longer than 63 days, the insurance company can add a 30% to their premiums for a year when they re-enroll. Removing the mandate would increase health insurance costs overall. Health insurance companies need the mandate to keep enough healthy people in their risk pool to pay for the sick ones. That's why they won't provide unlimited access to insurance without the mandate. Without it, people will wait until they are sick before buying insurance. If only the sick bought insurance, insurance companies would not be profitable. No insurance company could offer coverage only to the unhealthy and stay in business. But the 30% premium increase may not solve the problem. A healthy person who let their insurance lapse will avoid the increase. Only a very sick person would feel the increase was worth it if that meant getting insured. Source: Sarah Cliff, The American Healthcare Act, the Republicans' bill to replace Obamacare, explained. Vox, March 6, 2017. 4. Remove the tax on companies that don't provide health insurance. Many employees may lose coverage as employers opt out. They will find that individual insurance costs much more than company-sponsored plans. 5. Eliminate taxes on high-income earners. Those earning $200,000 a year would no longer have to pay extra Medicare taxes. The bill repeals taxes on drug and other medical supply companies. Here are the details on these Obamacare taxes. But those taxes paid for the benefits. The Congressional Joint Committee on Taxation estimated that $460 billion in revenue will be lost from the tax cuts over 10 years. $270 billion from high-income and investment taxes. $145 billion from insurers. $25 billion from drug makers. $20 billion from makers of medical devices. Republicans have not explained how their plan won't add to the debt. Source: Health groups denounce GOP bill as its backers gamble. New York Times, March 9, 2017. Replace the Obamacare tax credits. The Obamacare exchanges allow people without company-sponsored insurance to shop for individual and family plans. They also distribute subsidies based on income. The tax credit is also based on the cost of the silver plan. As insurance costs rise, so does the subsidy. The HealthCare Act provides a flat tax credit based on age. Younger than $32,000. 30 to 39 $2,500. 40 to 49 $3,000. 50 to 59 $3,500. 60 and older $4,000. The credits start to phase out for individuals who earn $75,000 or more, and for households that earn $150,000 or more. The subsidy is not based on the cost of plans. As insurance costs rise, the subsidy remains the same. That means it does not take into account the higher cost of living in states such as Hawaii and Alaska. Source: Analysis. GOP plan to cost Obamacare enrollees $1,542 more a year, Vox, March 7, 2017. It also means the cost of individual plans will probably increase for most people. A study by the Commonwealth Fund and Rand Corp found that an individual policy would cost $4,700 by 2018 if Obamacare were repealed. If Trump pushed through his tax deduction on premiums, the cost would be $3,500. That compares to the average cost of an exchange policy of $3,200. Source: What Trump's win means for your wallet, Money, November 9, 2016. In addition, women could not use tax credits to pay for abortions. Low-income families would lose additional ACA subsidies that pay for out-of-pocket costs. Source: The GOP healthcare plan just won't work, NBC, March 8, 2017. The GOP Obamacare replacement plan defunds Planned Parenthood and restricts abortion coverage, Vox, March 7, 2017. 7. Allow everyone to use and deduct health savings accounts. Currently, HSAs are only available for those with high-deductible insurance plans. The accounts help pay for care until the deductible is reached. It doesn't help people who can't afford to set aside income in the HSA. Changes to coverage and costs. 8. Remove the mandate to provide essential health benefits. The good news is there will be low-cost plans for those who don't need coverage for all 10 essential health benefits. The ACA currently requires all insurers to cover things like pregnancy, mental health, or equipment treating a chronic disease. That would provide lower-cost plans for healthier people. The bad news is that it will probably increase premium costs for plans that offer the 10 essential benefits. 9. Replace limits on premiums for older people. Under the ACA, premiums for older people couldn't be more than 3 times the costs for younger people. Insurers are now allowed to charge 5 times as much for seniors. 10. Give states a block grant for Medicaid. Phase out Medicaid expansion by 2020. The block grant means the federal government will stop sharing a percentage cost of Medicaid. Instead, it will give each state a fixed amount. In return, they can design their own Medicaid benefits. Insurance companies would only have to comply with state, not federal, regulations. Trump believes that would make the states more efficient in their use of funds. It also means that Medicaid would compete with other state priorities for the funds. That's what led to the failure of community mental health centers under deinstitutionalization. Trump nominated Seema Verma, who helped Mike Pence create a Medicaid expansion plan in Indiana, to lead the Centers for Medicare and Medicaid Services. She advocates that Medicaid recipients pay a small monthly fee to receive Medicaid. Source: If Trump's Medicare chief is approved, they'll need to be on your best behavior. Time, March 6, 2017. Why the health insurance industry is calm despite Trump's Obamacare threats. Fortune, November 30, 2016. In 2020, states can no longer sign up new adults to the expanded Medicaid program. That would prevent 4 to 6 million people from getting insurance by 2014. Source: 10 million to lose insurance under GOP's Obamacare replacement plan, S&P says, NBC, March 7, 2017. They would not be able to afford preventive care or treatment for chronic diseases. Instead, they would wait until the diseases created a crisis. They could then go to emergency rooms that must treat everyone. This more expensive care is billed to Medicaid. Low-income patient would use expensive hospital emergency rooms as their primary care physicians. That increases healthcare costs for everyone. Source: House GOP releases plan to replace Obamacare, CNBC, March 7, 2017. For that reason, major hospital groups oppose Trump's plan. They realize their emergency room costs will increase once preventive care under expanded Medicaid is withdrawn. Source: Health groups denounce GOP bill as its backers gamble, New York Times, March 9, 2017. 11. Strip federal funds from Planned Parenthood. It would strip Medicaid and Title X reimbursement for Planned Parenthood health care services for low-income patients. These federal funds are never used for abortions. But Republicans are concerned that the organization uses the funds for research they oppose. This action could increase Medicaid costs, since many of its recipients use Planned Parenthood for routine health care. That includes family planning and contraceptives. If those services are cut, the act could ironically increase the number of women seeking abortions. It's unlikely this component will pass. 2 Republican senators oppose Planned Parenthood defunding. Source: The GOP Obamacare replacement plan defunds Planned Parenthood and restricts abortion coverage. Vox, March 7, 2017. How it affects you. Your premiums will probably go up if you fall into one of the following categories. You have a chronic disease. You are older. Premiums for a 64-year-old are estimated to rise from $8,500 to $10,600 a year. Source: I read 7 Obamacare replacement plans. Here's what I learned. Vox, November 17, 2016. You become pregnant. You lose coverage for 63 days, then reapply. Your company only provided coverage because the ACA forced them to. You are one of the 22 million people who received subsidies or the Medicaid expansion. You use mental health services, including drug rehab. Your costs will probably decrease if you fall into one of these categories. You are healthy. You are young. The Vox article estimates that premiums for a healthy 24-year-old are estimated to decline from $2,800 to $2,100 a year. You don't lose coverage. You don't have insurance. You earn more than $200,000 a year. Even once it passes, the new plan won't affect individuals until November 1, 2017, at the earliest. That's because plans bought on the exchanges are a legally binding contract between the person and the health insurance company. Source: Trump and the GOP can absolutely repeal Obamacare. Vox, November 9, 2016. You should get health insurance as soon as possible to be protected. Those without coverage when TrumpCare goes through may not be able to afford insurance. That's because insurance companies would charge more for those with pre-existing conditions. For more, see How to Get Obamacare in 4 Simple Steps. Healthcare costs will probably rise at a faster rate. Before Obamacare, healthcare costs increased 3% a year. They are now rising less than 1% a year. For the facts, see current U.S. inflation statistics. That's because Obamacare helped more people receive lower-cost preventive care before they needed high-cost emergency room care. Reduced benefits to low-income populations increases their reliance on emergency rooms. That's because they can't afford preventive treatment. They wait until chronic conditions become a crisis. Federal law requires hospitals to treat them. That raises the cost of Medicaid and health insurance. Source: Trump promised to repeal Obamacare. Now what? Reuters, November 9, 2016. To understand the ACA better, see my book The Ultimate Obamacare Handbook, 2015 to 2016. Next steps. The Republicans don't have the 60-vote majority in the Senate to repeal the Affordable Care Act. Instead, they will use the budget process to dismantle spending and revenue portions of the ACA. That means they can repeal the middle-class subsidies and end Medicaid expansion. They can also eliminate Obamacare taxes and abolish the individual mandate. They can remove the non-budgetary elements. These include lifetime and annual limits on coverage, and limits on annual out-of-pocket costs. Source: Budget Reconciliation Explained, Vox, November 23, 2017. Trump nominated Representative Tom Price, RGA, to head the Department of Health and Human Services. That department manages Medicare, Medicaid, and Obamacare. Price wrote the Empowering Patients First Act, which Obama vetoed. Source: By picking Tom Price to lead HHS, Trump shows he is serious about dismantling Obamacare. Vox.com, November 28, 2016. There are 3 obstacles to Trump's health plan. First, he must submit his proposal to the states by April or May 2017 if he wants any changes to occur in 2018. Each state set up its health insurance exchange or signed on to the federal government's site. The states have the final approval since they are responsible for implementation. Source: Trump stands by universal healthcare, Stat, February 5, 2016. Second, Price and Speaker of the House Paul Ryan must get the approval of other Republicans. Some conservatives think the plan doesn't do enough to repeal Obamacare. Others don't like that the bill is being put to a vote without Senate hearings. 2 senators oppose defunding Planned Parenthood. Source: Health groups denounce GOP bill as its backers gamble. New York Times, March 9, 2017. Ryan outlined his health reform ideas in The Better Way in 2016 and the Patient's Choice Act in 2009. He agrees with using block grants to fund Medicaid. That would cut Medicaid spending by $160 billion by 2022. He suggested replacing Medicare with vouchers to purchase private health insurance. Source: Why the health insurance industry is calm despite Trump's Obamacare threats, Fortune, November 30, 2016. Analyzing the House GOP replacement for Obamacare, Citizens Against Government Waste, July 2016. Third, Price must negotiate with lobbyists for health insurance companies and pharmaceutical companies. The health insurance lobby, America's Health Insurance Plans, opposes the bill. It opposes reductions to Medicaid financing. The ACA's expansion brought them many new customers paid for by the federal government. Source: Health groups denounce GOP bill as its backers gamble. New York Times, March 9, 2017. They will bring lawsuits against any plan they don't support. They played a significant role in forming Obamacare. For example, they are responsible for the individual mandate. That's because they won't insure those who are sick unless the government mandated that even the healthy were covered. Trump's plan would force companies to take only the sick people who would sign up. That's like asking auto insurance companies to insure only those who have been in car accidents. If forced to do so, insurance companies would go out of business because they couldn't make a profit. It wouldn't work, and they wouldn't agree to it. Other TrumpCare possibilities. On his first day in office, President Trump signed an executive order to ease the burden of Obamacare. It directs agencies to do what they can within the existing law to lift the ACA regulations. They can create more exemptions for people. This is a way to weaken Obamacare's requirement that everyone must have insurance or pay a tax. Source: Trump signs Obamacare executive order, TheHill.com, January 20, 2017. Trump announced on March 7 and 8 that these 2 proposals will be forthcoming. Allow health insurance companies to operate across states' lines. Each state has specific regulations. That makes it expensive for a national company to operate in different states. As a result, 5 companies service half the insured population. Trump maintains that the increased competition would drive insurance costs down. But it could increase these 5 companies' monopoly power. The Supreme Court would have to change the law. That's because it has ruled that insurance is not subject to federal oversight. Another way to modify the law is to amend the Constitution itself. Source: Susan Randall, Insurance Regulation in the United States, Regulatory Federalism and the National Association of Insurance Commissioners, 26 Florida Street UL Rev. 625, 2014. Allow Medicare to negotiate lower prescription drug prices with pharmaceutical companies. Trump had backed away from that idea in a meeting with pharmaceutical companies on January 31, 2017. Obama, Clinton, and Sanders have also proposed this idea. But Congress would have to amend the act that established Medicare Part D. It explicitly prohibited Medicare from negotiating. Drug companies said they needed that protection to provide funds for research and development of new cures. Also, the Congressional Budget Office found that Medicare wouldn't save much more by negotiating. That's because health insurance companies already do a lot of negotiation. Source: after meeting with pharma lobbyists, Trump drops promise to negotiate drug prices. Vox, January 3, 2017. Not up for negotiation. U.S. News, February 26, 2016. Trump has mentioned the following ideas, but they are not in any current congressional plans. Keep existing Medicare and Social Security benefits intact. These benefits were created by prior acts of Congress and cannot be changed by a president. These two programs cost $1.565 billion, or 38% of total spending. Social Security is self-funded until 2035. Medicare is only 53% self-funded. Keeping benefits intact does not solve the problem of rising health care costs. For more, see mandatory budget. Offer a universal market-based plan. Trump originally wanted to provide a range of choices similar to the Federal Employees Health Benefits Program. He proposed this in his 2000 book, The America We Deserve. In 2016, he suggested expanding Medicare. Ironically, that's what was in Obama's original healthcare reform plan. Congress rejected it for a plan that relied on health insurance companies. Trump might find that Congress still doesn't want universal coverage. Neither do most Americans, who are worried that it's a sign of socialism. That was one reason for the failure of HealthCare. Source: Donald Trump on healthcare, on theissues.org, 2016. Require healthcare providers to post prices for their services. That allows people to shop for the best value. The competition should drive prices down. Allow consumers to purchase drugs overseas. That will drive down drug prices. Source: Healthcare Reform, DonaldTrump.com. Donald Trump hates Obamacare, July 31, 2015.